And as always, every Sunday, it is now time for Sunday House Call. And joining us, of course, is Dr. Mark Siegel. He's Associate Professor of Medicine at NYU's Langone Medical Center and author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And also Dr. David Samadi. Great to see you. The upcoming Chair of Urology at Lenox Hill Hospital, Professor of Urology at the Hofstra Northshore LIJ School of Medicine. Doctors, good morning.
Good morning.
Great to see
Good morning,
you.
Docs.
Nice to see you.
Hey, Jimmy. Welcome back.
Oh, thanks. Great to be back with you. And we want to talk about this first topic because it's so important, the sudden deaths of two young men shining new light on two diseases. Just this past week, best-selling author Vince Flynn and well-known actor James Gandolfini died. Both will be so missed, and both from diseases that are potentially treatable if caught early enough. Let's talk about Vince Flynn first. Prostate cancer diagnosis in 2010. 47 years old, Dr. Samadi. What could have been done differently?
Okay, so this is a really good point because everyone thinks prostate cancer is an old man disease. And in our practice, we see a lot of guys like him that are diagnosed early 40s and 50s. One of the first things I want people to do is to get their PSA checked, at least get a baseline at the age of 40, especially if you have genetic issues, if you're African Americans, if you're high risk, check your PSA, and then after the age of 45, get that every year. The AUA is changing the guidelines, and I think a lot of guys like him would go absolutely without detection. So that's the important thing. Now, he was 43 when he was diagnosed. I would have probably, without knowing too much of the detail, I would have offered him the surgery. Surgery is the best option for young patients like this because you remove the prostate, you know exactly what's in the prostate, your PSA after that should be 0, so he would be comfortable. I use radiation only as a backup plan, as a plan B that can be given after surgery. If you do radiation first, it would be very difficult to do surgery after radiation, and that's what a lot of people don't know. So it's unfortunate that a great author, icon like him is gone, but prostate cancer actually kills. It's a silent killer. And a lot of people think it's a slow-growing disease. You die with it, not from it, and that's a mistake. And we see that even young men like this can get very aggressive prostate. In fact, I will tell you that prostate cancer in young men is very aggressive and should be treated aggressively.
But there's a conflict about whether or not you get your PSA checked at that age. Let me go to Dr. Siegel, but let me ask you first, what's the minimum age? We've talked about this. If you have a family history, obviously you start sooner, of every man in this country getting his PSA checked.
You should get a baseline PSA at the age of 40. It's good to know where you start. If it's absolutely normal, you don't have any risk factors, then you go to 45, and every year look at the trend. That's basically what I do in my practice. The youngest person in my practice is 32-year-old, Jamie. These guys will die or they would get metastases, and it's a simple blood test. What you do with it is the skill of your doctor.
Fantastic, and a great warning and advice for men out there. Let's talk about James Gandolfini.
I want to say a couple of quick things about Vince Flynn first. First of all, I was a huge fan of his writing, the Mitch Rapp series. A lot of people really liked him. We're going to miss his books. I want to emphasize a couple of David's points. I check PSA. I don't understand why that's a controversy. It's what you do with a PSA. We can follow a trend. We can follow a free PSA. I can send the patient to a urologist like David if I have a concern. We follow it over time. PSA doesn't mean biopsy, doesn't mean surgery. It means knowledge. The second point is, and David's made this before, when you operate on someone and remove the prostate, you follow a PSA of 0. 0 is your target. You want 0. When it goes above 0, you go in and do something about it. It's easier to follow 0 than to have to give radiation and not know if you got all the cancer. You can give radiation after surgery, but once you give radiation, it's very hard to operate.
That's a very important point that a lot of people don't know. And again, when you're young, if you look at like his history, the last year that he was writing all these books, he was in a lot of pain. So I think radiation is a desperate treatment in younger guys like this, and you got to be careful and talk to your urologist.
All right. Then, of course, 47 years old, prostate cancer, Vince Flynn, James Gandolfini, the shocking loss, of course, known for being Tony Soprano, died in the hotel room. He's 51 years old. He's vacationing in Rome with his young son, goes to the Vatican, has a great day, has a dinner, 10 p.m., found slumped in the restroom. Dr. Siegel, that's like the ultimate nightmare for every middle-aged man. I mean, that you're going to get hit and you're going to be in the bathroom and that's it.
There's a couple of warning signs here. I mean, he ate 2 large fried shrimp cocktails that night. You know, he ate a lot. His diet was not under control. He didn't exercise. He had that apple belly that we talk about, which has inflammatory hormones in there that is bad for the heart. Sedentary. 35% of the people who die from heart attacks in this country, Eric, 35% are sedentary, and only 22% of Americans exercise. We talk about it on the show every morning. You got to do your morning exercise, even if it's just walking. You got to see your doctor. You got to make sure you don't have high blood pressure. We don't know if he had that. Smoking, I also want to say to people out there that cigar smoking is a risk, because everybody says, oh, I don't inhale that cigar, but the smoke gets in. So smoking, alcohol, he was a drinker. Smoking, alcohol, you got to know your blood pressure, you got to know your cholesterol, you got to get your weight down, you have to exercise, you cannot be sedentary, and you got to watch your diet. All wake-up calls. Now, autopsy shows that he didn't have a problem before, that he died of a sudden heart attack. I don't want to scare anyone out there. That can happen too. You get a plaque rupture, you don't even know you have heart disease, and this can happen.
Well, you know, they talk about that meal, the reports that he just had another light meal, but a meal's not going to do it, and if you don't have the evidence of that as the autopsy had shown, how do you know you could have a problem?
Well, first of all, I personally really miss him. I mean, his programs were fantastic. The big thing is, how do you distinguish between heart attack and acute sudden death? That's what you want to know. When it comes to heart attack, it's a vascular issue. There's a plaque, there's a cholesterol, there's a blood clot. It stops the blood flow, and you get that same chest pain radiating to the arm, or you may be too tired, or you may be having cold sweat. A lot of symptoms that's not specific. Acute cardiac arrest, which is what he had, it's a sudden plumbing problem. The heart stops. That's some sort of electrical problem, some sort of arrhythmia problem. If you have a heart attack that's massive, it's going to turn the heart into like out of sync, and then you can collapse. Loss of consciousness is a symptom, and it's already too late. The question is, what do you do? If you have nitroglycerin, you should give them immediately until 911. Time is of an essence, and I don't recommend people do this, but if you're desperate and you see the heart is really in trouble, you can hit the person in the chest really hard. Right here.
You saved a life doing
that. He did this week.
Last week, unfortunately, there was a patient that happened in a party, and you just basically hit them hard. You can jumpstart until 911 gets there and buy time for yourself. It's scary.
You know, next week, I'd love next week to talk to our viewers about what you can do if you find somebody stricken. It might be a good thing to talk about.
How about an aspirin? They say if you
have it, absolutely, because you buy time. So aspirin or nitroglycerin, obviously, if you can get some history from someone.
If you know CPR.
Yeah. All right, well, he will be missed, and his funeral is on Thursday.